Hello, everyone.
Daming pusong masusugat.
Welcome to our review class for our very good practitioners from the Philippines. Today, we shall be exploring the diagnosis of heart disharmonies through tongue analysis. Okay, we all know that tongue diagnosis is fundamental because it offers valuable insights into the health of the heart, not only the heart, but also other organs. So by examining the appearance, the color, shape, and coating, we can identify disharmonies and imbalances that reflect the body's internal conditions. Okay, so first let's discuss heart-yin deficiency. And we all know that if one has heart-yin deficiency, there is no coating, right? And this is very frequent in adults, in older adults. So they will present symptoms like sleeping disorders, dry mouth, especially at night, and heightened anxiety. So heart-yin deficiency in younger adults could be due to chronic emotional stress, excessive excitement, hectic lifestyles, and substance abuse. So there. The tongue's shape and color, particularly at the tip. Look at the tip. Do you see it? Provide critical insights into the state of the heart energies. So, if you have a red swollen tip, this indicates heat from deficiency. Okay. While a cracked or peeled tongue suggests heart-yin deficiency. Cracked or peeled tongue is heart-yin deficiency. When the tip is swollen and red, there is heat. So there is empty heat. So there is heat arising from deficiency. Now let's first discuss heart-yin deficiency. This is common in adults, frequently observed in older adults, leading to, so when you see this in older adults, they will have sleeping disorders, anxiety at night with dry mouth. Physiologically, diminished kidney yin in older individuals affects the nourishment of heart yin. So, ideally or normally, the kidney should provide the yin to the heart fire, right? So, in this case, the reason why heart yin deficiency is quite common is because if you consider an elderly to be deficient in kidney yin, so definitely it cannot counteract the fire of the heart yin, right? So, diba ideally, can you comment, Sir Mark? Do you see this in most elderly? Hmm? Kasi medyo maedad na, so the
Pag
kidney,
may pag may edad pag may edad na Doc, yung kidney yun niya hindi na kayang umakyat sa heart niya.
yes, kulang na nga eh.
Opo.
Kung may kidney essence deficiency na. So, expect this talaga. So, we need to always subject ourselves to acupuncture, like maybe twice a month, no? Okay. As the cooling qualities of the heart yin decline, the heat can rise. Okay. So, as we grow older, the cooling qualities will decline of the heart yin. So, the heat can rise. So, there will be irritability and anxiety, which are more pronounced in heart yin deficiency. In older adults, the diminished strength of the kidney yin is a normal physiological change. This will lead to insufficient nourishment of the heart yin. So this can lead to sleep disorders, increased anxiety, so memorize that. Dryness in the mouth, particularly at night. Now let's talk about heart yin deficiency in younger individuals. In younger people, this will be linked to long-standing emotional issues. So if you see heart yin deficiency in the young, no, so this is almost always due to long-standing emotional issues, constant excitement and agitation, or probably they have a very hectic lifestyle, they have no time to sleep, drug abuse, or they have an inherent constitutional weakness of the heart. Okay. Individuals with heart yin deficiency may experience anxiety, insomnia, and restlessness. So alam nyo na yung possible causes, no? Okay. This can significantly impact their daily functioning and overall quality of life. So what are the key indicators? So you have to always inspect the tongue shape. Take note the tongue shape, no? So there is really fire here kasi masyadong mahaba, no? And also observe the tongue color changes. Look for cracks or fissures. So if you see cracks or fissures, that's definitely heart deficiency. Now, if the condition is a little bit chronic, no, lalo na if it's due to long-standing emotional stress or drug use, you will have heat arising from yin deficiency. So you will be looking at a red swollen tip, no? So peeled coating shows deficiency. And by the way, we just have to look at the heart area. So if you take a look closely, there is no coating, no, of the heart area. Okay. Now let's go to heart blood deficiency. Okay. Heart blood deficiency is more common in women. So there will be palpitations, anxiety, forgetfulness, disrupted sleep. Okay. And this is because the heart will rely on a sufficient blood supply to maintain its function and store the spirit. So if a female patient will have difficulty falling asleep, that is heart blood deficiency. But once asleep, they usually stay asleep throughout the night. So if you are suspecting heart blood deficiency, you should always ask the sleep pattern. No? So do they find it difficult to fall asleep? No? Yun. So this is in contrast to heart deficiency, where patients, sorry, okay, where patients wake frequently during the night due to restlessness. Okay. Inadequate blood supply will lead to symptoms like irritability and insomnia. Now, we should always remember that the heart um, should be supplied with blood because the heart is the residence of the Shan, right? So if you have heart blood deficiency, then expect symptoms like irritability. Okay. Over time, blood deficiency can contribute to further complications. So there will be heat because of deficiency. So there will now be more pronounced symptoms. Okay. So heart blood deficiency is characterized by difficulty falling asleep, but once asleep, the patient can maintain sleep throughout the night. The tongue will typically appear pale. Remember, this is blood deficiency, no? So this means inadequate blood supply. This affects the color and vitality. In heart yin deficiency, they have difficulty maintaining sleep. So if heart blood deficiency is difficulty in starting sleep, in heart yin deficiency, difficulty maintaining sleep. So they awaken, they always wake up in the middle of, yeah, and significant restlessness. And the tongue is usually red in color, unlike in heart blood deficiency, it's pale. So why is it red in color? Because of the heat from the deficiency and a lack of nourishing yin. Okay. So that's all for now. Thank you so much.